Doc, I'd like to ask you about the study that came out around a week ago dun sa The Lancet. That's a study by, I think, 6 British, Americans, and Canadian researchers on whether or not airborne na nga yung, or airborne all the while, yung COVID-19. And in that article in The Lancet, the researchers made a very, very strong push for revising existing health protocols to just to make sure that we address the issue of whether or not COVID-19 is airborne. I'd like to ask you if you're satisfied with our existing protocols, because the health department says na okay na yung pagmamask at pag-face shield.
Yeah. Well, first of all, the idea that the SARS-CoV-2, the virus causing the COVID-19, is airborne. It can be just through aerosol. That's already that's been known even before. It's just that we need confirmation from the big scientific groups based on big studies. But it was already a theorized and maybe thought of by most people. However, let's also bear in mind that it doesn't change what is currently being done. Whether it is droplet-borne or airborne, the same minimum public health standards will still follow. Although, I should say that because it has now shown increasing evidence, there's now increasing evidence to show that it is actually airborne, then all the more that we have to look at proper ventilation and air circulation in an enclosed space. Like I can cite that as examples, schools, offices, working places. Yes, because if it's airborne, that means it can circulate for long periods of time.
Yes, Doc.
Unless, droplet kasi it drops to the ground.
Opo. But Doc, on a more practical scale po, for example, in schools, in workplaces, what should be in place in terms of ventilation? From a medical point of view, what kind of steps should be put in place to make sure that, in practical terms po, we understand what you're saying and we agree. Yung nga lang how do you operationalize it? What should we look out for? What should we watch out for? What should we put in place? Kumbaga.
Yeah. It's the proper ventilation standards, which the DOLE has been developing and will be releasing. It's being updated because you don't want it to happen that, of course, you're wearing face masks, face shields, but once you remove it, particularly if you're in a closed environment with family and if it's airborne, any person who left the room who might be getting the virus, even if it's no longer physically present in the room, may actually leave the virus there circulating for other people to enter and be potentially infected. That is the implication there. That is why I was saying that the proper ventilation, meaning adequate circulation of air with replacement of used air with fresh air should constantly be happening, so that if ever there's a virus there, it can actually go out and be replaced with new air that doesn't contain the virus. Okay. So that's basically what I'm trying to say. All the more that ventilation will be an important issue because it's the air currents, how air circulates in an enclosed room that will matter.
Dr. Montoya, from the
But we still keep the minimum health standards, that's based on even the assumption that we are keeping those standards in place. Face mask, face shield, social distancing, washing of hands, all of this.
We understand, Doc. Well, actually, Doc, what I wanted to ask is whether we should upgrade the standards. The minimum health standards as it is should be the minimum nga, but I was wondering if we should raise the bar a bit more, considering na in the study kasi it also mentioned that, for example, there were infections between adjacent rooms, not even the same rooms. There were infections between magkatabing kwarto. People who were not even in the same rooms got infected. And the virus traveled through air ducts in the case of caged animals.
Precisely.
So there were those.
Yeah, that is why the only way you can ensure that air is properly circulating and old air is being replaced by fresh air or new air. I should use the word "quote unquote" new, meaning it's not in the room for a long time. It's being replaced by a new air. Is to have a proper exhaust system, The problem is, I think, for those situations, they're actually sharing the same air.
Nililipat lang.
Basically, that's what it means. Because how can it possibly go to the other room if it doesn't share the same air duct? And there's no exhaust. That's my assumption there. Because if there's an exhaust, it's not supposed to go to the other room. It's supposed to go out.